We're a collection of about 50 people that are interested in a particular type of immunotherapy, which is using the immune system to fight off cancer. And we do that particularly by using antibodies, which we make in the lab, and then we use those to target cancer cells in various different ways. We're looking at ways in which we can make the immune system more effective for using antibodies to delete cancer cells. So all sorts of things, basically all the time looking at better ways of improving antibody immunotherapy.
We know the immune system recognises cancer. We know that it's probably recognising what's called the mutinome, all the mutations in cancer. The problem is that within the microenvironment of a tumour, this immune system gets switched off. So it's quite likely now that with the right antibodies we can block that inhibition. So you inhibit the inhibitor and you can activate. It's a bit like a caffeine for the immune system. So we know that the cancer switches off the immune system. So rather like the way you'd wake up in the morning feeling rather groggy, particularly after a hard night, when you wake up and you want to feel better, you have a shot of caffeine, and we see our antibodies doing a very similar thing. They're stimulating the immune system. They're not changing what it normally does, they're just making it do it better. And we're specialising particularly at the moment on making the best immune stimulating antibodies, because we think that's an area where we have a track record and where we can contribute the most.
We're particularly focused in my group on lymphomas and leukemias, but we have obviously an interest in the solid cancers as well. We think that we're going to be able to learn things in the lymphomas that are very important as general concepts for how we target cancer, and then we're hoping to be able to translate them to the more difficult to treat cancers such as the lung cancers and colorectal cancers. It's incredibly exciting. I think that you're getting to the point where some people have been successfully treated past 5 years and look like their disease has been removed, which is fantastic, and not many other therapies really have that capacity or potential. So I think immunotherapy is where the real excitement is.
Everybody now has a very positive feeling that in a few years we're going to be able to, I'd use the word cure, a lot of cancers and a lot of patients with those cancers.